Moving along. On page 9, section 8, where it says physicians performing abortion procedures and abortion or reproductive health centers shall conform to rules of office-based surgery of the Alabama State Medical Association. Okay, fine. Shall meet the standards prescribed in the rules for off-based procedures. Well, and they talk about sedation. They don't sedate patients. They walk in and they walk out. And again, they are regulated by the health department. I want to know how many doctor's office where they do sometimes have to sedate patients and put them under are required to be treated like an ambulatory center. Of all these requirements where halls have to be so many widths and everything like that, I would say a lot of doctor's offices would close. I went to the dentist's office, he had a small office. As a matter of fact, little space I was in was about the size of 2 desks put together, well, 4 put together, and that's where you were. And they are performing a lot of procedures. Administering Novocaine and whatever they use the happy gas to knock you out with. Sometimes you're conscious, sometimes you're not. But again, in section 9 it says an abortion or reproductive health center shall be classified as an ambulatory health care occupancy and meet all the standards. I would say the standards that they meet right now are not very high. When you start talking about safety codes for the Board of Health may adopt to facilitate the ambulatory, but again, they are not inspected as often. An ambulatory center is just what it means. The person is ambulatory. They can't walk, they are rolled in. They don't walk in and they don't walk out. So we want them to conform to looking like little ambulatory centers. But again, there's no reason to treat them that way because, first of all, they deal with one reproductive centers. When it comes down to abortions, if somebody is in there for abortions, they do one patient at a time. You don't have a situation where you got 10 people lined up on a gurney. And the last time I was at the hospital with my sister, I think they only put her in a little, you know how they take you back there in the emergency where you're a little closed curtain? They put her in one of those because she came in an ambulance. But there were about 3 or 4 patients, they were bringing them in, lined up in the hall. You don't have those situations in reproductive centers. Again, it's not about safety. It's about trying to deny access. Now, the other issue on page 12, and I'd like for somebody to explain to me why. Section 13. Any person who can demonstrate personal injury, including physical injury, emotional distress, or mental anguish. Again, how much time I got? 14 minutes. Mental anguish, emotional stress. Where such injury has resulted from the failure of an abortion to a reproductive health center is to conform to this act, may maintain a civil action suit against the abortion or reproductive health facility and its administrator. Why are we holding them to higher standards than we hold medical doctors in hospitals? Why not use the Medical Practice Act that is law, that all doctors, those in hospitals have to abide by? Why are we holding these people to a higher standard? They're not a hospital. They don't have hundreds of patients. They don't even have 30-some patients or 10 patients that they're treating at the same time. But yet we want to hold these people to a higher standard. Sounds like persecution to me. It sounds like this is an Alabama business that we don't like. And because we don't like you, this legislature, it is the intent to close you down. That could happen to anybody. Depending upon which way the winds blow during election year. We don't like you. We pass a law and we close you down. I remember a time that there was another group of people in another country that didn't like them either. And they decided to indoctrinate the people. And they all put them in one place. And they decided to extinguish them. That was law during that time, during that era. Let's move across the water to the good old U.S. of A. I remember a time that there were people who were legitimate citizens here, taxpayers, had businesses, upstanding citizens. Something happened on the other side of the water, and because these people look like the ones over there, it says, let's lock them all up. They look different. They look like the other people. And they locked them up and they incarcerated them. Moving a little bit closer. Just 50 years ago. I remember that. Because I'm one of those kids that used to ride in the back of the bus. It wasn't that long ago. And we had a governor of this state. We remember that governor who stood in the door and who preached. And that's why we have a poor, failing educational system right now in this state. You see, we can pass all the accountability, flexibility, everything else that we want to pass. But you got to go back and understand why it's like that. And it was upheld, and it was sanctioned, it was condoned by the good legislators of the state of Alabama. Now we are here in 2012 and 13. And we look around for easy pickings. And we see people who look different. And we say, it's only 12% of them. It's not but 5 of them in the Senate. Maybe 10, 11 of them in the House. Let's pass this bill. It sounds good. We have a group of people over here pushing. They're the far right, the far religious right, or whatever. And we come up and we pass another bill. And we deny access and we deny choice. And we want to regulate the Bible. But as someone reminded me, we are sworn to uphold the laws of this state and the laws of the Constitution of the United States. And I do believe the laws of the United States says abortion is legal. If it is illegal, why are we then trying to close down legitimate clinics that provide a legitimate service because we don't like them? And I know my time is about up, but I do have some amendments that I want to offer. So, Madam Chairman, if this is the proper time, someone could tell me that I
certainly offer an amendment, Senator Coleman.
I'd like to.
Look at the bill.
and Amendment to House Bill 57 by Ms. Coleman. On page 3, line 13, delete certain circumstances, insert in lieu thereof the following cases involving minors below the legal age for consensual sex. On page 4, delete lines 9 to 11 and renumber the remaining subdivisions accordingly. On page 4, line 27, after the word process, add the following: and these standards of participation shall not exceed current medical standards as defined by the State Board of Health Division of Licensure and Certification. On page 7, after line 10, add the following new section 4 and renumber the remaining sections accordingly. Section 4, this act shall not apply to any abortion or reproductive health center existing on the effective date of this act. On page 9, delete lines 15 to 27 inclusive in their entirety, and on page 10, delete lines 1 to 14 inclusive, deleting all of section 9 in its entirety, and renumber the remaining sections accordingly. On page 12, line 13, after the word act, add the following language: in conformity with the Alabama Medical Liability Act.
Mr. President, Mr. Sponsor, I'd like to explain, if you have your bill there, I want to go through this.
Go right ahead.
Please explain the amendment, Senator Coleman.
Thank you, ma'am. On page 3, which is the first one, it says line 13. Again, this goes back. And I understand that you all want to pass this bill, and I'm not wanting to pass anything that's going to hurt women. The bill passes, I just want to be passed as a better bill. But let's be clear about what it does. On page 3, line 13, and again, asking for clarity, certain circumstances should be defined, it says, and in that case, it does not define it, it's a part of the act. It should be added in cases involving minors below the legal age of consensual sex. Now, you can say it's already in there. All right, let's put it in this section on this line so that we'll understand that these are the certain circumstances that you make reference to. And the sponsor of the bill, once it gets available, we can talk about these if he likes.